When a deployment concludes, the immediate physical threat fades. Stepping from the highly structured, adrenaline-driven environment of an active war zone into the quiet routine of civilian life presents an entirely new set of obstacles. The uniform comes off, but the requirements for physical rehabilitation, psychological support, and immediate employment remain. Navigating these complexities requires a safety net specifically calibrated to the military experience. In Georgia, the Veterans Coalition Foundation organizes that support. Representing 1.8 million veterans across all branches of the armed forces, they provide the collective advocacy needed to ensure those who served have a clear path forward. This mission is led by Dr. Drew Keenan. As the Foundation's Chief Financial Officer and the National Surgeon General for Veteran Affairs, his career trajectory dictates the organization's approach to advocacy. Coordinating a statewide defense for nearly 2 million veterans requires a specialized architectural skill set, forged through decades of high-stakes exposure to the specific hurdles of reentry. The Foundation prioritizes medical stability, securing healthcare access and PTSD rehabilitation for returning service members. They also advocate for modern alternatives, like medical cannabis, providing veterans with a legal, physician-supervised option for managing chronic pain and sleeplessness. This commitment to clinical advocacy began in 1971, when Keenan's civilian life was interrupted by a draft notice. He joined the United States Navy, completing his initial training at the Recruit Training Command before specializing as a hospital corpsman. He spent 13 months deployed to Vietnam, serving on the ground with the Fleet Marine Force. Battlefield conditions required rapid medical advancement. During his service, Keenan earned 8 PEGMICL readings, mastering everything from laboratory diagnostics to orthopedic podiatry. He worked on the front lines of trauma care, managing complex injuries and fitting orthopedic prostheses for wounded service members. After his honorable discharge, he applied this experience to a civilian career as a senior medical examiner and director of genetic medical testing. Navigating frontline trauma and subsequent clinical practice creates an advocate who understands the exact requirements of a modern veteran healthcare policy. Reintegration relies as much on financial stability as it does on physical health. Without a clear path to vocational training and steady income, the transition from active duty remains incomplete. The Foundation advocates expanding the Work Opportunity Tax Credit to incentivize Georgia employers to hire veterans facing employment barriers. As this chart shows, expanding these credits significantly increases regional GDP and labor income, while reducing the state's reliance on public assistance programs like SNAP. Orchestrating these legislative shifts requires a deep understanding of corporate finance, a background Keenan began building in the financial district of New York. A graduate of the New York Institute of Finance, he managed operations for major investment houses long before applying that expertise to the nonprofit sector. He currently leverages that financial training as the CFO of the Veterans Coalition Foundation. Achieving veteran prosperity requires more than morale. It takes the technical literacy necessary to navigate tax codes and corporate economic incentives. The final requirement for effective advocacy is political unity. The Foundation works to organize independent veteran service organizations into a single cohesive voting bloc. They maintain accountability by publishing regular report cards, documenting exactly how elected officials vote on veterans legislation. This ensures a constant, unified presence at the Georgia State Capitol when funding for veteran services is being debated. Keenan's command of this process is grounded in decades of civic duty, including 4 terms on a city planning commission and his role as a 3-time All-American VFW post commander. His leadership style is informed by a varied civilian life, including 20 years breeding American paint horses and competing on the team penning circuit. True advocacy requires the discipline to organize disparate factions into a unified political force that cannot be ignored by the governor or the legislature. Supporting a modern veteran requires a multidisciplinary approach: the clinical insight of a medic, the strategy of a CFO, and the organizational grit of a commander. For leaders like Dr. Drew Keenan, the commitment made during enlistment does not terminate with a discharge. It evolves into a lifelong responsibility to provide mentorship and quiet leadership for the veterans and families who follow. These leaders work to ensure the infrastructure of advocacy is already in place before the next generation of service members completes their final tour. It is a mission rooted in the understanding that the most significant service often begins after the uniform is put away. Some men leave service, others become the reason service continues. Presented by the Veterans Coalition Foundation, Inc.